Can ozone therapy cure Candida infection in the gut? I don't believe it can. I don't believe that ozone therapy is a good approach to treat Candida infection in the gut. Or at least I don't believe that ozone therapy is a good, reliable ozone treatment, or that it should be the first line of treatment when it comes to Candida infection, specifically in the gut. So this may surprise some of you, especially coming from someone who calls herself the crazy ozone lady, but please don't shoot me and I will explain why I believe that. So first of all, ozone can absolutely kill Candida. So there have been a whole bunch of studies performed. So when you go on PubMed and you type into the search ozone and Candida, you will find a whole bunch of studies where, for example, what they did, they took dentures, so dental appliances, so dentures, which were contaminated with Candida, and they exposed them to ozone gas or to ozonated water. And it has been shown that the ozone was able to eliminate the Candida pretty well, and pretty reliably. And so there's a whole bunch of such studies, which show that Candida can absolutely be killed by ozone. And what they also did, they also exposed the human oral cavities with Candida infection inside to ozone, and again it was found that the ozone could reliably reduce the amount of Candida spores in the oral cavity. Other experiments with Candida and ozone, they have shown, for example, they took glass dishes, so Petri dishes. They cultivated some Candida spores in the Petri dish. They exposed those spores to ozone, and again it was shown that ozone was absolutely able to dramatically reduce the amount of Candida spores in those Petri dishes. So we know that when Candida is directly exposed to ozone, that it can absolutely kill it. But the situation in the gut is a little different, and it is more difficult to get directly the ozone and to get the Candida to be directly exposed to the ozone when the Candida is in your gut. Because let's remember that the gut, so we're talking about the small intestine and the large intestine, so together we're looking at a length of around 20 feet, plus minus, which is around 7 meters. So basically you would have to find a way to expose all the tiny nooks and crevices along those 20 feet to ozone. And you would have to also find a way to do so for a sustained length of time in order to kill all the Candida spores. And this, in my opinion, is not a good idea to try to do this for a number of reasons. But the number one reason why I believe that this is not a good idea to try to eradicate Candida in the gastrointestinal tract with ozone is because I don't believe that trying to kill Candida, doesn't matter whether with ozone or with antifungals or with something else. I think some people try chlorine dioxide to kill Candida. So I don't believe that any killing procedure, any killing mechanism is the right idea when trying to address Candida infections in the gut. And so let me explain why that is. So some of you may have sent in your stool for a stool analysis to find out what kind of bacteria you have in your stool, whether you have a healthy digestion, what the enzymes look like, the pH of your stool, and just for a stool analysis. And so if you have done this, then you may have seen that one of the types of life forms that they're checking for are Candida spores. And so Candida is part of a healthy human being's gut biome. So even someone who's perfectly healthy, who has no digestive problems whatsoever, such a person will have trace amounts of Candida spores. So Candida is simply a normal part of the human gut. So consequently, if you tried to eradicate Candida, you would try to eradicate a part which is just a healthy, normal part of our gut biome. So I don't believe that this is the right approach. And so Candida, in most cases, in the vast majority of cases in humans, does not cause any problems. So in the vast majority of cases, it is a benign life form, a benign yeast. And only under certain circumstances does it turn into a problematic yeast. And so we need to look at those circumstances and change those circumstances. I believe that this is the right approach, not trying to kill it. And so one of those circumstances that turn the benign Candida into a problematic infection are, of course, antibiotics. So we know that antibiotics, this is one of the main reasons why people develop Candida overgrowth in the gut. So many people, for example, go into a hospital to get surgery done, and then after the surgery they are prescribed antibiotics as a prophylactic in order to prevent that they develop some bacterial infection. But what this causes is a secondary problem in the form of a Candida infection. So this is quite common. And in some cases, this Candida infection can turn fatal. So in the US alone, around 1.7 million people come down with a Candida infection, and this results in around 300,000 deaths due to sepsis caused by Candida. So this normally benign life form, this normally benign yeast that is present in all of our guts, in some cases can turn fatal. And so the reason why it turns fatal is because of antibiotic use. And what do antibiotics do? They create an imbalance. So they kill off the good bacteria which keep Candida in check and prevent it from becoming an infection, from becoming its pathogenic. So consequently, I believe that what we should do is to re-establish a healthy gut biome. And this can be done through a multitude of ways, and I will go through this in a minute. So this is one reason how the benign Candida can turn into Candida overgrowth in the gut. Another reason is a compromised immune system. And this is often observed, for example, in diabetics. So diabetics, they are at a very high risk of developing Candida, not only in the gut, but also in the skin, for example, and the extremities, I believe, and like, for example, in the genital area. So Candida is quite a problem for diabetics, or can be quite a problem. And the reason for this is, number one, a compromised immune system, and also, of course, the chronically elevated blood sugar levels, which is something that is perfect for Candida, because Candida, of course, thrives on sugar. Another risk factor is long-term corticosteroid use. So corticosteroids, those anti-inflammatory drugs, they can also compromise the immune system when they're taken long-term. And this is also another risk factor to develop Candida overgrowth. And also cancer patients who undergo chemotherapy or radiation, they have the same problem. Their immune system is destroyed after those treatments, and they are at an elevated risk of Candida overgrowth. Other problems, other risk factors are, for example, a diet very high in sugars. So if you're a sugar junkie, if you eat a lot of sweets, chocolate, or things with high fructose corn syrup, then your blood sugar also will go through spikes, and those spikes also predispose you to get a Candida infection in your gut, to develop a Candida infection in your gut, and to, of course, compromise your immune system. Birth control pills are another such factor. So the estrogen in birth control pills tends to elevate the blood glucose, and this again can lead to development of Candida overgrowth. So now, depending basically how this Candida overgrowth came about, then you should basically move accordingly. So if the problem was because of antibiotic use, then you should try to reestablish your gut biome. And so people can do this through a multitude of ways. So you can take probiotics. You can eat fermented foods, so things like sauerkraut, kimchi, yogurts, kefir. But when it comes to probiotics, so let me say one thing. Specifically for Candida, I believe very good are lactobacillus strains. And the reason is because lactobacillus strains, they create acid, so they lower the pH of your poop. And this is good. This is specifically good to prevent Candida overgrowth, and this is also good for your liver. So Candida, we know that Candida produces ammonia, which is highly alkaline. So this increases the pH, and this creates an environment that is beneficial to Candida overgrowth. And when you counteract this ammonia with acid, and with acid-forming probiotics like lactobacillus strains, then this is another natural way of keeping the Candida in check. So yeah, healthy gut biome through probiotics or through fermented foods, this is one way. Now, it's possible that also fecal matter transplants could be successful in treating Candida, although I don't think we have data on that, so I don't think this has been ever treated or undertaken. I think fecal matter transplants, they are used quite often for people with Clostridium difficile, and very successfully so. But I don't think for Candida, but I don't see a reason why they would not work. So this may be another possible option. Other things that one can take is things to increase the stomach acid. So basically with Candida, you want basically improve your entire digestion. So starting with the stomach, so in increasing your stomach acid or lowering the pH of your stomach acid. And you can do this, for example, by taking apple cider vinegar, or by supplementing with betaine HCl, or also by supplementing with vitamin B1 or thiamine, which is very important for the production of stomach acid. So then the next step in the digestion will be the liver. So you also want to look at bile production and whether the bile is transported freely into the small intestine. So for that, you can take lactoferrin, you can take milk thistle, alpha-lipoic acid, vitamin K2, and also again vitamin B1, because the liver, this is the biggest storage of vitamin B1 is in the liver. The next point is pancreas. So if your pancreas does not produce a sufficient amount of enzymes, you can supplement with digestive enzymes, and this can also help you to keep Candida in check. But the digestive enzymes also need B1 in order to function properly. So B1 is a super important vitamin specifically for the digestion. So those are just some ideas that you can do to improve your entire digestive tract in order to keep your Candida in check. And of course, one of the most important things, because Candida, as mentioned, loves sugar, so it thrives on sugar. So of course you want to reduce or completely eliminate sugars from your diet. And so we're talking not only refined sugars, but also sweeteners that are based on carbohydrates. So, even evaporated cane juice, and some bars sweetened with dates. For example, dates are very high in sugar, or stuff like coconut flour, nectar, all those alternative sugars, which are still based on carbohydrates and will also elevate your blood sugar. They won't elevate your blood sugar as much as refined white sugar, but this may still be significant and still can make your Candida thrive on it. Honey, the same thing. Even if it's raw honey, this can also feed Candida. So you want to eliminate all sugars, preferably. I believe the only safe two sugars are stevia and was it monk fruit or mink fruit? I forgot, monk fruit, I believe. So I believe those are the only ones that are safe because they're really zero calories and they do not raise your blood sugars at all. But stevia can be a little hard on your liver, so you may go easy on that. Right, so yeah, eliminating sugars, this is very important. So a change of diet towards a meat-based, low or medium carbohydrate diet without any sweeteners or sugars would be preferable. Now, if your Candida overgrowth is because of pharmaceuticals like birth control pills or like corticosteroids, then of course you want to find alternatives to this. So an alternative to corticosteroids is ozone therapy. Ozone therapy is a very, very potent anti-inflammatory intervention. So this will be probably the best option, but not the only one. There are many other natural anti-inflammatory approaches. And with birth control pills, you know, there are so many different alternatives. Yeah, there are many, many options. So this is the main reason I believe why I don't think that ozone therapy is a good way to try to fight Candida infection, because just the idea of trying to kill the Candida is, in my opinion, the wrong idea. And the other reason is, you know, something that I already mentioned is when you're dealing with the intestine, you're dealing with all the nooks and crevices of the intestine, so it's 20 feet or 7 meters. So the amounts of ozone that you would have to use in order, if you wanted to really eradicate all Candida spores, it's just, I don't think that this is a realistic endeavor. And if you achieved that, then you would also, while trying to eradicate Candida with ozone, you would also eradicate all the good guys. So also all the good bacteria which are in the gut, because let's remember that ozone does not discriminate between good and bad bacteria. So ozone will kill any and all bacteria. So some people, I think, still believe that ozone only kills the bad guys, and the bad guys are the anaerobes, and so the aerobes, the aerobic bacteria, they have nothing to fear, and so you can do as much ozone as you want. It won't damage your good aerobic bacteria. No, it's exactly the other way around. So the good bacteria, 99% of the gut's good bacteria that we need to digest fiber and carbohydrates and all this stuff that needs to be fermented in order to be digested. So 99% of that good bacteria resides in the large intestine. And the vast majority of them, I think this is also 99%, are anaerobes. So they thrive and survive in an oxygen-deprived environment. So the good bacteria, the vast majority of the good bacteria in our guts are anaerobic, and they will absolutely be killed by ozone. Ozone, again, kills both aerobes as well as anaerobes. It does not distinguish that way. So if you tried to ingest a lot of ozone through oxy powder, drinking ozonated water, doing liters of rectal insufflations, you would probably not only kill the Candida, but kill also everything else in your gut, basically sterilize your gut. And this can be quite dangerous because we know that the gut biome is super important for our mental health, for our bone health, and for our immune system. So this is, you know, trying to kill Candida is, in my opinion, the wrong approach. Doesn't matter whether it's with ozone or with other conventional antifungals or whatever there is. So, so in general, does it make sense to add ozone treatments to treat Candida infections? So having said everything that I just said, you know, I don't think it's a good way to use ozone primarily as an anti-Candida treatment. I don't believe this. But as a complementary, as an adjunct treatment, yes, I believe it does make sense because of the immune system. So as we can see on diabetics, so diabetics, as mentioned, they're at an increased risk of developing Candida infections. And ozone is a great immune system booster. Well, in reality, it's an immune system modulator. So if the immune system is overactive, ozone will lower it. If the immune system is underactive, then ozone will boost the immune system. And with Candida infections, the immune system tends to be underactive. So ozone will boost the immune system and will help the body to in the fight against Candida. So if the person who is suffering from the Candida infection in the gut, I believe that it is a very good idea that that person does some ozone therapy at the same time in order to boost their immune system. The same if someone has just been through a course of corticosteroids and their immune system is compromised, the same thing. So which types of ozone treatments would be a good idea in such a case? Basically, to use them as a complementary anti-Candida immune system boosting therapy. So I believe that any type of intravenous ozone treatments is really one of the best ways to have like a system-wide immune system boost. So any type of intravenous ozone treatment, so this can be things like ozonated saline IV, major autohemotherapy, direct intravenous ozone, 10-pass, multi-pass, EBU. I think those are all the intravenous ozone types. So any type of intravenous ozone treatment, you know, if you have someone close to you, an ozone practitioner, when you can go and get this done, then this would be a good idea. If you don't have such an option, if you don't have anyone that could perform intravenous ozone therapy on you, then I think what is a good solution here are ozone saunas. Ozone saunas, I keep preaching about ozone saunas, have been preaching for years. I think that they're the number one overlooked treatment. Well, now maybe with whole cut saunas, not so much, but ozone saunas are absolutely fabulous. A great immune system booster, a great systemic ozone treatment. And it does not have to be the whole cut. Okay, so I've never done a whole cut in my life. I've only done regular ozone saunas, and I have seen great results from it. I have seen some major impact, positive impacts from doing ozone saunas. So to the point that I have really a hard time imagining how much better a whole cut could be. Okay, so you can achieve a lot with regular saunas alone. Then what you can also do, again, as a complementary adjunct treatment, is drinking ozonated water or doing vaginal insufflations. Let's remember, vaginal insufflations are a systemic treatment. Vaginal insufflations are not a local treatment, not just a local treatment. So those are all good ways to try to boost your immune system and so help your immune system in the fight against Candida. And I'm also rethinking my stance on rectal insufflations. So people who have been following me, they probably are aware that I'm not a big fan of rectal insufflations. Well, at least I'm very skeptical about the claim that rectal insufflations are as good as intravenous ozone treatments. I don't believe that. They have some systemic effect, but I don't think anywhere close to intravenous treatments. But you know, now that I've had my liver toxicity problems, so people who are subscribed to my newsletter, they know about this. So I'm now again rethinking everything. And it's very much possible that rectal ozone treatments, that they have a beneficial effect on liver, and that they can help the liver to detox and also to produce more bile, and also possibly to help with bile ducts if the bile ducts are inflamed. If the liver is toxic, if it is full of toxic sludge and vitamin A, then the liver ducts can be inflamed and narrowed. Ozone therapy, being a strong anti-inflammatory agent, it's very much possible that it helps to open up the liver ducts and basically the bile to flow through. So it's possible that rectal ozone treatments could have an indirect benefits an indirect beneficial effect on treating Candida by helping the liver with bioproduction and biotransport. So those are my thoughts on ozone therapy and Candida. So let me know your experience with ozone therapy and Candida. If you believe that I'm full of it, you know, if your experience was exactly opposite to what I've been saying, let me know about this in the comments. I believe, you know, what I said here is a gross generalization, and there's I'm sure there are people who had great experience with ozone therapy and treating Candida in the gut. If that is you, let me know. And if you'd like to listen to more of my smart essery or read about it, then please subscribe to my newsletter. There's a link in the description of the video, and my book is coming out soon. I have already received the proofread version of my manuscript. I just want to add another chapter that I will also send to proofreaders. So in a week's time. So subscribe to my newsletter, and you will be notified when the book is ready. All right, let me see. Are there any comments? So I will only address comments about Candida. Michael, is ozone water beneficial for sore throat? Okay, this is not Candida. Yes, I believe so. Pure gum spirits of turpentine is fantastic for Candida control. That's possible. Yes, I have tried it. Turpentine is much less disgusting than I thought it would be. It is totally a doable protocol, I think. Whether it's effective against Candida, it's possible. Hi there, how about IV ozone with UV light for Epstein-Barr virus? Yes, I think absolutely, give it a try. I think that UV light with ozone IV, this is like basically gives the ozone IV an extra boost, because UV light creates ozone, creates tiny amounts of ozone in the blood. Really, I believe in any liquids, you know. Treating water with UV light, this is a way to sterilize it because it creates ozone. So yeah, go for it. All right, guys, thank you very much for checking in and tuning in, and see you in the next video, and subscribe to my newsletter. See you. Bye-bye.